Welcome to segment 3 on brain injuries. We are talking about brain tumors.
Yes.
This is our third segment. Oh, no. You know, that's one of the things about this. They put on these commercials, which are good. We like commercials. Again, Senior with Nurse Linda, part 3 on STRN Network. This is Dr. Campbell, and this is Nurse Linda.
Thank you for coming back. We're going to keep the camera from having a seizure this time.
Well, I hope so.
We can hope for the best. But we're going to continue the whole idea on the silent epidemic or silent killers in our body, and we're continuing this segment, this whole 3 segments on the brain. And this one we're going to cover brain tumors. And it really surprised me when I was doing my research on this, some famous people with brain tumors. Some people were known about it because they came out and talked about it, and one was Elizabeth Taylor.
She had a brain tumor?
Yes, she did. Yes. Yep, she dealt with that for many years. She managed it very well because she had good follow-up. She
went to see
care.
Professional help, yes.
Tug McGraw.
Who?
Tug McGraw. You're not a sports person.
Okay.
One of the best relief pitchers ever to play the major leagues.
Oh, okay.
Yes. You don't care.
I don't have a clue.
Gary Carter, another sports figure. He was one of the best catchers ever in the major leagues. Just passed away within the last year or so. Ted Kennedy, I think most people know about Ted Kennedy. Thor Heyerdahl.
Ted Kennedy. Is he the alcoholic one? Oh, the other one.
He had other issues, but he died of a brain
tumor. Chappaquiddick?
Yes. Yes, that
yeah.
Ted Kennedy, yes. Thor Heyerdahl?
Oh.
Yes, he had brain tumor. Irene Ryan. That surprised me. I was not aware of that. She played Granny in the Beverly Hillbillies.
Yeah.
She apparently had a brain tumor, and back then, at that time in the 70s, you didn't always disclose what your diagnoses were. She never knew she had a brain tumor. Her doctor never told her because there was nothing they could do about it. And she actually passed away during a performance of Pippin on Broadway.
Really? I didn't know that.
Yes, she had a stroke and passed away, yes. Yeah. Elizabeth Taylor, I think everyone knew about. Gene Siskel, movie critic, I think everyone knew about that.
He's dead, isn't he?
Yes, he is. Yes. Most brain tumors are fatal, and people will die from them.
Can't they go in and take them out?
Not always. It depends on the type. And that's where a brain tumor is a mass or growth of abnormal cells in the brain. Some are benign, some are cancerous.
But it'll still kill you.
A benign tumor can kill you depending on the type it is, or if it's not cared for properly. There was a woman many years ago I cared for who had a benign brain tumor, and as it grew, she would just go in, have it, portion of it cut out. She couldn't have it all cut out because of the type of tumor it was. And eventually, after about her 5th or 6th surgery, she did not come out of the surgery. That's what happens with the benign tumors. Some symptoms of brain tumors, because people don't recognize what the symptoms are.
How do you get one of these in the first place? It's cancer.
Sometimes it's a DNA glitch. Sometimes it's exposure to radiation, to chemicals. So people who are in the chemical industry are usually aware of this, and they wear masks, they wear other protective equipment, they limit their exposure as much as they can, and you don't see as many of these things now as you did back 30 years ago because of the knowledge we've gained of exposure. Symptoms. People don't recognize what the symptoms are. If you suffer from headaches, if there's a change in those headaches, or if you've never had headaches and all of a sudden develop headaches, blurred vision, a change in your speech pattern, someone who spoke very clearly before, excuse me, now was having trouble finding words or had slurred speech.
Well, on the TV program that I watched last night, the person was talking to God, and God was answering. And it turns out that he had a brain tumor.
That could very well be seeing things that are not there. Depending on the area of the brain that's being affected, I've had patients who will see pets or animals in their rooms that aren't there. They hear things that aren't there. Sometimes a development of ringing in the ears could be tinnitus or tinnitus, which is very benign. It could be a brain tumor.
I've had ringing in my ear since I was like 6 years old.
Yeah.
If I had a brain tumor, I'd be a corpse by now.
Seizures, which we talked about in the previous segment, could indicate a brain tumor. They can set off seizures, so you have to get them looked at, get them diagnosed. We talked a little bit about the risk factors. Sometimes a family history of brain tumors can put you at higher risk, like with any disease. If there's a family history of high blood pressure or heart disease, same thing with brain tumors. Your age, your race. Brain tumors are more frequently found in people of Caucasian descent than in people of other races. Don't know why. I knew that was going to be the next question. Don't know why. Some of the complications could be having a stroke and left with permanent weakness, blindness, being in a coma. All of those things could happen from having a brain tumor.
Well, never good to have something poking around inside your brain.
No, but getting it evaluated, getting it treated appropriately. Sometimes it's as simple as medication, because it could be a very slow-growing tumor, which you will die of something else before you die from that tumor. It happens. There are people who lived long, perfectly healthy lives, died of old age, never knew they had a brain tumor because of the type of tumor it was. Our ability to diagnose things much sooner are making us more aware of what's actually normal in our body as we age.
How do you diagnose this?
Usually a CAT scan or an MRI of the brain. An EEG sometimes is done to also determine that, and that's patterning the electrical activity in the brain. But those are usually the first ways that you get it officially diagnosed. Seeing a neurologist, seeing an oncologist, a cancer doctor, are all appropriate in order to make sure you're managed appropriately and safely.
So you have a brain tumor, what do you do?
Follow the doctor's instructions. If it's a tumor that needs to be resected, meaning cut out, get it cut out. Why are you going to leave it there? What's the benefit of doing that? If most of them now, they deal with radiation treatments.
A little radiation pill in there?
Not a pill, but close to that. They actually can do some pills. They'll put seeds, radioactive seeds in certain places. Yes. They do what's called a gamma knife, which is a radioactive laser knife that they go in and can take very small slices, and that can be more precise than old-fashioned surgery. And old-fashioned surgery is still sometimes needed, and it's amazing and interesting because they keep you awake many times during that surgery.
So they ask you questions.
Ask you questions. You do not feel anything, but you are awake and aware of what's happening. They give you medicine that you don't care a whole lot, but you're still awake. They want to make sure they're not going to touch anything they shouldn't when they're trying to remove all the pieces of the tumor. So they'll say, pick up your right hand. Can you feel this? They want you to respond, and they'll ask you to say, count to 10. And when you're counting and they poke something, you'll count 1, 2, 3, zebra, cow, 5, 6, 7. They know they've poked something they shouldn't have.
That's good to know.
Yes, absolutely.
Because I don't use zebra as a number or cow. Okay, we are out of time for this segment. Any closing thoughts?
No, just any abnormal symptoms, things you're not sure of. A weakness you can't explain, a change in headaches, a change in vision. Go to your eye doctor, get it looked at, and then go from there. But do the follow-up that's necessary. Don't be afraid of the end result.
Because being afraid won't make a difference.
It won't. It really won't.
You were listening to Senior Moment with Nurse Linda. And that was Nurse Linda. And we had another seizure. Anyway, thank you so much for tuning in. If you have any questions, call 803-941-7231.
We'll check the camera for a brain tumor before next week.
Oh, indeed we will. Thanks for listening.